you ever had a burn?
Yes.
Yes. Are you aware that there's different levels of burns?
Not really, because I've never really been burned that bad.
Okay, well, let me explain. There's a first-degree burn. There's also a second-degree burn. And then there's a third-degree burn. What a first-degree burn is, it's the burning of the top layer of the skin. It's burned very lightly. A second-degree burn is burning of the deeper layers of skin. And a third-degree burn is generally burning of all the layers of the skin. What I'm going to demonstrate today is what your first-degree burn, your second-degree burn, and your third-degree burn will look like, how they're cared for, and the measures of protecting them. First, we're going to start with the first-degree burn. This is going to be your first-degree burn and how it will generally look. It's not a bad burn. It's a red. It will present a red tint to the skin. Some blistering may occur. Not much, if any. These burns are not going to be real. These are moulage burns. Just to give you an idea of what the burn would look like. And this is what a first-degree burn would look like. This type of burn can be caused, like I said, by touching a hot surface. It can also be caused by sunburn. It can be caused by a chemical. So we're going to begin by cleaning this burn, making sure it's clean. So I need you to walk over to this area. What we're going to use is some saline. If you don't have saline, that's fine. You can use cool water. Never use ice cold water. If you have a burn, you're not going to want to take your hand and place it in ice cold water. That's not a good measure. So this is the saline. And what we're going to do is just rinse this burn and make sure it's all clean. Then we're going to dry it off. You don't want to rub, just pat. Make sure it's clean. I just need you to hold your hand open for me, AJ.
Alright.
And we're going to take the antiseptic spray and cover the entire burn with it. Now, if you don't have any antiseptic spray, aloe vera cream can be used. So we're going to go ahead and spray the antiseptic spray. Saturate the burn with it. We're not going to dry this spray. We will go ahead and turn your hand. We're going to go ahead and cover the burn with the gauze. The gauze is sterile. Open your hand for me, please. And just lay it down right here. Just going to open up the gauze. Here where I can get a nice wrap going here. Open your hand for me, please.
Want me to give you the tape after?
Yes, I need the tape. And if you open your hand for me.
I can.
Just make sure the burn is covered completely. Open your hand for me, please. And it doesn't have to be a perfect wrap as long as the burn is covered. So we take the tape next and we go ahead and take the gauze so that it stays. I'm I'm just gonna go ahead and tape in a basic manner. Open your hand for me. The first part I taped was around the wrist, and then I'm gonna go. Open your hand for me, please. In between the thumb and the rest of the hand. And just spread that thumb for me, please. Thank you. And this will keep the gauze on. It's not perfect, but it's covering the burn. And you're going to keep this from getting wet because the antiseptic is on it. Generally, a first-degree burn takes about 2 to 5 days to heal. And that's how you take care of a first-degree burn. All right. Next, we're going to demonstrate how to care for a second-degree burn.
Look at this.
And just remember, in between, if you have more than one patient, you're always going to wash your hands in between patients. So I'm going to go ahead and dispose the gloves, wash my hands. I'm going to start with the second burn. Okay. Let me get some gloves. We'll go ahead and get started with this second burn. Okay. This is Adriana, and what Adriana has here is a typical second-degree burn. Like I said, a second-degree burn is burning of a deeper layer of skin. Now, a second-degree burn can happen from exposure to heat. It can happen from exposure to an open flame. It can happen from chemicals. It can happen from, again, touching a hot surface, but not leaving your hand, not taking your hand away as briefly as a first-degree burn. When you experience a second-degree burn, it's going to look a little different. It will blister. You'll see the skin turn a light reddish color. Sometimes the skin will turn a dark blackish red color, and it hurts more than a first-degree burn. So there's some pain. This is not a real burn, but this is how it will look. So that's why she's not in any pain. The first thing we'll do is clean the burn. So Adriana, just need you to get up. I'm going to walk over here and clean our second-degree burn. We're going to start again by cleaning it with saline solution. It can also be cleaned with water, generally. Never, again, it's never going to be cleaned with ice cold water. So we're going to go ahead and pour the saline solution on the burn and clean it up a bit. If you're using water, you're going to want to use running water, just to make sure all the little bacteria and everything is off the burn. After we get the burn nice and clean, you're going to look at it, make sure it's clean. If it's not quite clean, then you'll go a second time with your saline solution or your water. This particular burn, you just pat it dry. Usually, I mean, it'll have paint applied, so you're just going to pat it a little bit to get it dry. Make sure the rest of the hand is dry. And for this burn, you're not going to use an antiseptic spray at all. You're going to apply an antibiotic cream or ointment. One that is for burns. You can apply it in a different manner. You can take the gauze and put the ointment on the gauze and apply the gauze to the burn. You can take a cotton swab and put the ointment on the cotton swab and apply it to the burn. The method I'm going to use is taking the ointment, applying it to the gauze. I'm going to take the gauze and work that ointment into it to make sure it's covering a large area of the gauze. If there's not enough ointment or cream on the gauze, just go ahead and add some more. You don't want to allow the gauze to touch anything like a countertop because at this point it's sterile. Your gloves are clean and your gloves have only touched the patient. You'll take the gauze with the ointment and apply it to the burn. Pat it down. This burn you won't tape. You just pat it. And this is known as a dressing. This dressing you'll change every 4 to 6 hours. You repeat the same measures. You'll clean it with the saline or your cold water. And you'll again add the ointment or cream to the gauze and make another dressing. You'll take the dressing and apply it to the burn. The burn generally will take about a week or two to start to see a healing process. Just because it's a more severe burn. And that's about it for the 2nd degree burn. If there's any pain, which there will be pain associated, you would take ibuprofen or some type of over-the-counter medication that's prescribed, that's usually used for inflammation. And that usually helps with the burn. If the burn gets infected in any way, then you would seek out help from a physician or your nearest emergency room. So that's it for the 2nd degree burn. And next we're going to go ahead and do the 3rd degree burn. I'm going to change my gloves again. And you can go ahead and lie the patient down on the floor, flat on the floor. This is a different burn. Your 3rd degree burn, It is going to be a burn that affects all layers of the skin. It's a very serious burn. I'm just going to get my gloves on here. This particular burn is on the lower abdomen, and when you're dealing with a third degree burn, you're going to want to clean the burn up and go to your nearest emergency room. So for this type of burn, what you're going to do is clean it with a saline solution. And we're not going to do too much here. I'm just going to demonstrate how you would normally care for this burn. So you would clean it with a saline solution. Then you would follow by adding the gauze just right on top of that burn. You would add the dry gauze, and then you can take some saline and soak some gauze and place it right over the dry gauze. This will keep the burn nice and cool until you get to your emergency room or your doctor's office. And that's really all you're going to do for a third degree burn, because it has to be cared for in a healthcare facility. This type of burn is caused by exposure to open flame. It can be caused by clothing catching on fire. It can be caused by a chemical explosion. Things of that sort. It's a more intense burn. It takes a very long time to heal. It can cause scarring. It can even lead to hospitalization. Usually, when brought to an emergency room for a third degree burn, you'll be brought to the emergency room. The ER physician will take a look at it, clean it up a bit, and will send you to a burn unit. That way they can care for it properly. They usually will apply something like a Silvadine, which is it's an ointment or cream that's applied to a third degree burn. It's prescription only, and they will cover it with some gauze, a gauze dressing, and it's changed about every 6 hours. And that's about it. That's all I have for the burns. There's, again, we're going to recap it. It's a first degree burn, a second degree burn, and a third degree burn. And the first degree burn is the burning of the top layer of the skin. The second degree burn is a deeper layers of the skin being burned. And then your third degree burn is going to be all the layers of the skin. The third degree burn is the more severe burn. It has to be cared for at a hospital or emergency room, doctor's office. Your second degree burn can be cared for at home, but it also can become infected. So you're going to want to watch that burn. And your first degree burn is going to be the burn that's less severe. It can be cared for at home, and it recovers. You recover from it in about 2 days, maybe 5 days at the most. But it's not as severe, and it can happen from sunburn. So that's about it. That's all I have for burns today. Thank you.